This feature is brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. In this episode of Views from the Front Porch, Dr. Christiaan Abildso speaks with Dr. Alan Beck about increasing physical activity in rural communities.
All right, thanks for joining me for another episode of the Views from the Front Porch podcast series about physical activity in rural America. My name is Christiaan Abildso. I'm an associate professor in the School of Public Health at West Virginia University. Today, I'm joined by Alan Beck. He's a PhD and is a project coordinator at the Prevention Research Center at Washington University in St. Louis. So welcome to the podcast, Dr. Beck.
Thanks for having me.
So if you wouldn't mind, tell us a little bit more about yourself and the reasons for your interest in rural physical activity.
Sure. I'm a project manager of a National Cancer Institute RO1 grant. We're aimed at increasing physical activity in rural areas at the Prevention Research Center at Washington University in St. Louis, as you said. I grew up in a small town, so I grew up in Stillville, Illinois. It's a rural small community in the southern portion of Illinois, which gives me a passion for trying to help people in rural areas live a healthy lifestyle. I began my exercise background actually in the military. I always enjoyed and was decent at PT while I was in the Army. I like to say my career as an exercise professional began in the intensive care unit in Balad, Iraq. I was a gunner in a vehicle rollover and was ejected from the vehicle. I had numerous back, neck, head injuries, and a bunch of bumps and bruises. I became fascinated during my recovery at how my body adapted to my various injuries, which really led me to the exercise science, exercise physiology for my bachelor's and master's degrees. Towards the end of my master's degree, I got a job as a clinical exercise physiologist at a local rural healthcare center in cardiac rehabilitation. And then during my time working clinically, I became interested in human behavior. We as exercise physiologists can prescribe exercise down to the minute to elicit, a specific response. However, we can't do anything if you don't show up. Therefore, I went back to get my PhD in health education as I became more interested in the human behavior side of things. My dissertation was centered around the initiation of cardiac rehab in rural heart failure patients. And during my study, it really hit me hard when participants, as a part of my study, started to die. Therefore, after my PhD, I wanted to focus more on the prevention of chronic diseases like heart disease, cancers, and those things.
Yeah, very good. Thank you. Thank you for your service, first of all, and thanks for relaying that. One of the most important things to ask, of course, is what's your favorite type of physical activity now?
Yeah, I would say, historically, it's always been body weight training with this system called TRX, came out years ago now. But as of late, I've actually enjoyed riding my new mountain bike while I pull my two sons behind me. One is 4 and one is 2. We're about to have our third son, so that may throw a wrench into bike riding because it's only a 2-seater, but that remains to be seen, I guess.
That means your older son needs to learn how to pedal on his own.
Exactly.
He's going to love that. Yeah, thanks for all that background. That's really cool. I think I actually have a little bit of training. Well, I have a training in sport and exercise psych, so we used to do a talk about beyond the exercise prescription, like how to get people to actually implement it. So it's pretty cool to see that. So I wanted to talk to you a little bit. I mean, you guys are doing some amazing work on Heartland Moves that work in rural southeast Missouri, encouraging trail use using a multi-level approach, combining trail events with walking groups, SMS, text messaging. We look forward to talking more about that. As we're talking about through this series, a number of us co-authored that paper, sort of the call to action back in 2016. And we concluded that with 8 calls to action, with 8 suggestions, really, including 2 I'd love for you to focus on as you talk about some of your recent work. That intervention in the Heartland Moves the Heartland Moves intervention really exemplifies the use of ecological models like Jim Sallis's, which is very influential, using that to develop a rural specific evidence base, and also using objective measures of physical activity in the rural research as we improve the evidence there. So if you wouldn't mind, just tell us a little bit more about that intervention.
Yeah. So first, to give some backstory, the Prevention Research Center here in St. Louis has helped to build roughly 40 walking trails throughout rural southeast Missouri. And then before this grant that I'm working on now, our team did a pilot study to essentially determine if people were using the walking trails honestly. And our findings really paved the way for what we're doing now. We like to use the analogy from the movie The Field of Dreams. Russ Brownson is the PI. He and I both love baseball. It's kind of the if you build it, they will come sort of scenario. However, that doesn't work with walking trails. Of the respondents to that initial pilot study, about 65% of the people in these various communities were aware of the walking trails, but only about 14% of people actually use them with any sort of regularity. Therefore, our multi-level intervention is truly aimed at promoting the use of these walking resources they have already in their community. So again, we're focused at the community, interpersonal, and individual level. At the community level, we've either created or tagged onto already up and running coalitions in each community. Our coalition work is focused on holding events at local walking trails to increase their visibility and then subsequent use. One of the best parts of our grant is we were actually able to hire a local person to run these coalitions. I personally believe our local coordinator is truly the key to our success. Being from a rural area myself, I know we have some trepidation in speaking to and working with people who aren't from rural areas. People that come from St. Louis. It's harder for us to open up to those kinds of folks. I get a lot further when I go to people in our area of interest by telling them I'm from a small rural town, tell them about my upbringing, as opposed to stating that I have a PhD in health education and work at a world-renowned academic institution. They don't really care much about that. They care about where I'm from and that I'm kind of one of them, basically. At the interpersonal level, we're organizing local walking groups in order to increase the physical activity there in all of these various communities. Our local coordinator, who is Miss Dixie Duncan, is really doing the heavy lifting on this as well. When we recruit folks, we ask them, are you interested in partaking in a walking group and or leading walking groups? She will then organize, track the multiple walking groups in multiple communities. I mean, it's really a big undertaking, especially now in the times of post-COVID world. Another aspect of our walking group will be to use kind of some newer technology from Stanford University. It's called the Citizen Scientist Method from Abby King specifically. Our walking groups will actually use a mobile app called Our Voice during their walks. And the app is really cool as you can take photos, video, record audio, or type messages into it to determine, facilitators or barriers of physical activity in your community. And all of that information is then captured and feedback can be provided by the community to the community leaders. So for example, if it's determined that a walking trail is in disrepair, the community members can take their issue to the mayor, for example, for reconciliation. It's been pretty exciting to see this app going to be used pretty soon. I've used it myself and I find it just amazing. And it's really user friendly as well. And it gives the community kind of a sense of buy-in too. And then at the individual level, we're using text messaging, and there are two types of text messages. One is kind of exercise-specific programming developed by the company themselves, and the other portion of that is community-specific text messages created by us to send out to folks. And that's the main level of the intervention. You also mentioned using objective measures in physical activity and sedentary behaviors, and we could have an entire hour-long chat about this. As the Rolling Stones would say, this has been a beast of burden for sure.
Understood.
We are using accelerometers and GPS devices to determine activity and their location, with the hope of people being active at the walking trails during the intervention. And then hopefully kind of lure them there with the intervention and then have them be more active there. What I'll say about these devices is it's a lot more manual labor than you might think. In our case, we have to call participants, charge and initialize the devices, package them with everything they need, and mail them out. we could be doing 50, 75, 100 at a time. Then when we get them back, download the data, determine if people meet the minimum wear requirements. And then in that case, if they didn't meet the requirements, we have to do that kind of all over again. Call them again for rewear and see if they'll wear the devices for us. What I've learned, honestly, through this process is that although the devices they're really quite small, as you may know, you really need space dedicated to the devices. We're trying to make it work in a shared cubicle space, and it's really difficult just for a safety and security standpoint, as well as HIPAA with participant information being put on packaging. Once we complete the baseline data collection, we're actually already in the works of creating a kind of I guess you call it a lessons learned type manuscript on using these devices in rural areas, because we've learned some pretty tough lessons pretty quickly, but it is nice to kind of help bolster, and we have our telephone survey, but also bolster our data with some actual objective measurements.
How many accelerometers do you have, approximately?
Right, approximately we have 150 or so right now that we use.
Yeah, that's interesting, and also the Abby King stuff and the citizen science. It sounds like a great way to do photo voice kind of work. I know some of us that do it are we try to figure out the best way to do it. I hadn't thought of using that for photo voice, so that's awesome. Well, thanks for all that.
Go ahead. You can use it for, you can use it in two different ways. You can have the individual participants download it on their phone and use it, or you can have, our main plan actually is to have our local coordinator take like an iPad to the walking groups and have them just walk with the iPad. It's kind of a little more kind of data control, because a lot of times the participants on their own will forget to press the button that says upload data, and that's like the last step they don't do usually.
Understood. Well, yeah, thanks for all that. So the other thing, and I know, in looking back through the couple of papers, which, we're talking about now about this work, and the other one, you use qualitative methods, so good mixed methods approach. So that was one of the other calls that we had, is to use qualitative studies to better identify those characteristics, to characterize, the unique variables that are influential in rural environment. So you guys are using key informant interviews, of course, as a method of both, just based on my read of it, as both community engagement and data collection, really learning from them and letting them engage and then learning from them. So would you, if you wouldn't mind talking about how and why you're engaging with those communities to create those community advisory boards and forming community coalitions as part of the Heartland Moves intervention, and maybe even a little bit about what types of people you're seeing serve on those boards.
Yeah. So initially our plan was to have one overarching community advisory board, actually, and during our key informant interviews, each community we found was really quite different. So we determined, first of all, instead of having one overarching committee to dictate what intervention activities take place in all of the communities, we decided to switch it to more of a local coalition for each individual community. Imagine, if you will, someone from a different community coming in and telling you what you should do to increase physical activity in your community, even though they're not from there. It just, it doesn't sit well kind of instinctively. Generally, the coalitions are comprised of health department employees. Often it could be the director and or some just everyday workers of the health department, parks and recreation people, if they actually exist in a given town. Some smaller towns don't have parks and recs actually. Local extension offices or local coordinators, also kind of the person that leads most of them, but some of them see also kind of hands off to the community members. Kind of the main kind of professional membership. However, we do have some membership from local people who just want to, they heard about this through the informant interview process, and they want to be a part of this and make their improvements to their community, which I think is really kind of cool when people are interested just to be a part of this.
Have you, sorry to interrupt, but have you noticed anything, any characteristics of those people specifically, those just community members that are interested? What about them? Are you seeing any patterns about them that makes them want to be involved? Or
yeah, it tends to be retired people, mostly women, I believe. It's kind of funny. One of the first community coalition meetings I went to after Dixie had gotten them up and running, there was this group of 3 or 4 retired ladies in one of our communities who were just, I loved them. They were so passionate about how they spoke to their community, and they wanted to see improvements, and they just kind of take the ball and roll with it. It's really quite fascinating.
Yeah, I mean, that's cool. Yeah, thanks. Sorry, I didn't mean to interrupt, but that struck me as something really interesting. So I think as those of us that have been to the small towns and rural places, that definitely each one is unique, like you like you mentioned in the paper, and the clannishness, the old county rivalries between schools and stuff.
Yeah,
they're still strong. Yeah, I mean, are there any other key?
I can kind of go back to like the main reason we chose to do the qualitative first was really to get a lay of the land. We also wanted to get feedback on what things we were kind of planning, what might or might not work in these communities. So what we interviewed 3 layers of people. First was kind of leaders, stakeholders like the mayors, health department people, those folks. Then we interviewed walking trail users and people who didn't use walking trail users. And the findings were, really interesting actually. With the community leaders and stakeholders, we found, like I said before, each town is unique. It could be that some have barriers like traffic. They're kind of larger, small communities still, while others may be more concerned with things like dogs that are unleashed. You never know what you're going to find, really. We also found, kind of generally, that larger communities have more resources and formal organizations. For example, a larger community of 8,000 likely has a Parks and Recreation department, an actual entity that has programming for Parks and Rec and maintains the parks. While a smaller community of about 2,000 has, I'm quoting this too, Jerry, who voluntarily mows the grass. It's just a guy that's retired that wants to help, keep the grass cut for the children to come play. So what we also found was if larger communities, generally about 6,000 residents or more, had very high poverty rates, we found the resources to be similar to that of the smaller communities. They didn't have the same resources. These are all things we have to consider when we're trying to pursue programming in these various communities. I want to make sure I make a distinction too, that just because, some communities are smaller does not necessarily mean they are worse off. For example, what we're finding is the smaller communities, they're used to working together on everything. While larger communities tend to have agencies, the health department, the Parks and Rec tend to operate more in silos. But in the really small places, they all work together. So the coalitions tend to run smoothly in those very small communities comparatively, which is really quite fascinating. Then, like I said, we interviewed, walking trail users and non-users to find, what's the difference in these entities and these folks. We looked at motives for physical activity. Non-trail users, if they were active, they tend to do it more for personal reasons, their physical health, weight loss, because their doctor told them to do something. Conversely, trail users are more interested in the social aspect of walking with others. And as we know, people who chronically exercise tend to do it because they enjoy the activity itself and aren't too worried about, what risks or benefits they have. They enjoy the actual exercise and time with others. In the same vein, we asked trail users and non-users what would promote physical activity in your community, what would make more people use the walking trails. The differences were similarly aligned with their motives, whereby the trail users focused on the enjoyment of nature and kind of mental well-being and being with others, while the trail non-users were more concerned with convenience and actually indoor space, indoor gyms. That was more of a importance to them. The one place I will say that really all layers, all the stakeholders, the trail users, the non-trail users, they all agreed upon, air quotes here, was needed to promote physical activity. So if I actually conducted the interview myself, I kind of pressed that answer because, what does education mean? And kind of funnily enough, most folks really had a difficult time explaining it. They couldn't tell me what education meant. I use the joke now of, Well, if we fly a plane over and drop leaflets that say exercise is good, does that work as education? Because we should know that, right? So that was kind of an interesting finding too.
That's from your old PsyOps days, if you know PsyOps. Sorry, my brother-in-law. Well, one thing I'd like to do is try to wrap up here, and obviously we're looking forward to more work coming out of and the results coming out of this work. And one thing I wanted to ask is, what are some of the key lessons learned, or other things you could share? Obviously, some folks that do a lot more in urban areas, or who are interested in working in rural areas, who may not have your upbringing, or may, are hesitant to go in and say, I'm the big city slicker, so I know what's wrong with you, kind of thing, and as they shouldn't do, right? What is maybe one or two key things to remember that folks should remember if they're starting to do this?
Yeah. I think it's important to build a relationship with the communities first. We always know that in most of the studies that are kind of focused on the community level improvements, we always look back at the limitations section. It always says, we wish we had more time for getting in the community, especially if you're an outsider, which is why I think it really helps. In our case, we were so fortunate to hire Dixie, who is a local person to that area. She knows everybody. Her phone number has the same area code as everybody else there. So where if I call from my phone in St. Louis, nobody answers it because of my weird area code. So I think really building that time in to get to know the communities, and if you can, hire somebody within the setting that you're going to be working in, especially if you are an outsider. And really another one that I would think is important that I've learned now was going back to I don't want to beat a dead horse with the objective measures, the accelerometers and GPS devices, but be sure you budget them appropriately and really think through how you're going to have people wear them. Are they going to come to you and you put them on in some location? Are you going to mail them? How does that work? How frequently do you contact them to get devices back? There's a lot that goes into that. And I think this is kind of a movement now to where most NIH studies, if you're going to measure physical activity, want some type of objective measurement too. So I think using them has been great. It's been a big learning curve for me. I hadn't used them previously, and I love them, but just be aware that it takes a lot of effort to maintain those things.
Mm-hmm. Yeah, awesome. Look forward to seeing that lessons learned paper too. That'd be good. So I appreciate the time, Alan. I know you guys are doing some great work. Ross has done some great work for many years. So I appreciate you taking the time to talk with us about it. And like I said, I look forward to hearing more and learning more about all the impact of those coalitions and stuff. Like you said, and in the small towns, all those people are just so intertwined that if you get them focused on something like this, then they can make some big impact. So I think what I'll do then is go ahead and wrap it up from episode 7 here from Views from the Front Porch. You're on your front porch. I got the back porch again here. All right, Dr. Beck, thanks so much. I appreciate your time.
Appreciate it. Yeah, take care now.
You too.
All right, bye.
To learn more about the research presented in this conversation, visit us online at jphmpdirect.com.